Okay, so my scene is safe. I have my PPE on, my scene is safe. Per dispatch, I am arriving on scene to a 59-year-old female with complaints of shortness of breath. I only have one patient. I'm going to request ALS. And due to the chief complaint, I don't think that C-spine precautions are going to be necessary. So when I arrive on scene, my general impression of my patient is that she's sitting in the tripod stance. She's working hard to breathe. I'm gonna go ahead and introduce myself to my patient. So hi ma'am, my name is Nicole. I'm an EMT on the ambulance. What's your name?
Marianne.
Marianne. She's talking to me, so her airway is patent, and she's tracking with her eyes, so she is alert. I'm going to assess her chief complaint of shortness of breath and if any apparent life threats, which appears that there's none at this time. Watching her chest rise and fall, it is equal, however she is breathing rapidly. So at this time I'm going to place her on a non-rebreather at 15 liters per minute. So I'm going to hook up my mask to the oxygen tank with the regulator, set that to 15 liters per minute and preload the reservoir bag. Okay ma'am, so I'm going to place this mask on your face. It may be a little uncomfortable, but let me know if we need to make any adjustments to it. So I'm going to have you take off your glasses for me just briefly. Place this on you, make sure it's fitting nice and snug. And how does that feel?
That's fine.
Okay, you can go ahead and put your glasses back on. Alrighty, and I'm just going to just briefly check your pulse here. It is rapid but equal. Her skin is pale, cool, and diaphoretic, and I don't see any major bleeding at this time. So I'm going to determine that this patient is a load and go. And in the ambulance, I'm going to go into more of history taking. So what were you doing when this pain or the shortness of breath started?
Sitting outside on my phone.
Okay. And does anything seem to make the shortness of breath better or worse?
Just breathing in deep.
A deep breath, okay. And are you having any pain associated with the shortness of breath?
Yes.
Where is your pain?
In my chest area.
Okay. And can you just point with one finger exactly where the pain is?
Right in here.
Okay. And does that move anywhere else?
No.
Okay. And how would you describe that pain?
A sharp pain.
Sharp pain?
Mm-hmm.
Okay. And does anything make your pain worse?
Just the breathing, just the deep breathing.
Okay. And on a scale from 0 being no pain at all to 10 being the worst pain you've ever felt in your life, what would you rate your pain?
A 6.
A 6, okay. And right now it is 10:18. What time would you say that this started?
About 20 minutes ago.
20 minutes ago, all right. And has this ever happened before?
No.
Okay. And have you ever had to have a tube go down your throat in order for you to breathe?
No.
No? All right. Now I'm going to go into my sample. Do you have any allergies to any medications?
No.
Okay. Are you currently taking any medications?
Yes.
What are you taking?
Norco.
Why are you taking Norco?
I recently had surgery on my knee.
Okay. How long was your knee surgery?
About a week ago.
Okay. And do you have any other medical history?
No.
Okay. And when was the last time you ate or drank anything?
About 2 hours ago.
2 hours ago? Okay. Alrighty. So now I'm going to examine you. I'm going to be listening to your lung sounds. Okay, so I'm going to have you just sit forward for me and take a deep breath. Okay, and again. And again. One more time. Okay, so her lung sounds are equal and clear. I'm gonna assess for any JVD around the neck, and I don't see any. I'm gonna palpate her chest. Does me pressing on your chest produce any pain for you? No? Okay. I'm gonna assess distal pulses again, and they are rapid but still equal. And again with DP pulses, rapid but equal. There is no edema in the lower extremities, but it does look like she does have some swelling around the left knee. Alrighty. So now I'm going to take your blood pressure. Do you have a preference on which arm I put the blood pressure cuff on?
No.
Okay, so my patient's blood pressure, her real blood pressure is 90/70, but due to my skill, or for my skill, I'm going to say that my patient's blood pressure is 180/90. I'm going to assess her pulse. Alrighty, so her pulse rate is about 60 beats per minute. And now I'm going to assess respirations. Alrighty, so my patient's breathing in about 14 times per minute. Before my scale, I'm going to say that her pulse rate is 140 and her respirations are 40 breaths per minute. The quality of her respirations is rapid. So my field impression of my patient is that she is having a pulmonary embolism due to long immobilization from her recent knee surgery. I am going to continue keeping her on the non-rebreather at 15 liters per minute, and I'm going to reassess my patient every 5 minutes en route to the hospital and give an accurate report on all my interventions and findings to the ALS team and ER team. And this concludes my skill.